All right, let's jump right in. We're going to talk about something pretty fundamental in healthcare today. What if? What if we've been looking for solutions in all the wrong places? We're going to explore a totally different way of thinking about mental health, one that's designed around the place where life really happens.
Wow. Yeah, that quote, that's really the heart of everything we're talking about today. It points to this huge gap, right, between our healthcare systems, all built around clinics and hospitals, and the actual reality of someone's struggle. That happens quietly, behind closed doors. So, what does that struggle really look like?
To really get it, to understand how big this is, we've got to see it up close. So let's step inside one of those homes. This is Amina. She's a new mom, and if you were to look from the outside, you'd think everything's fine. Perfect, even. But this is so important because it gets at a fundamental truth, doesn't it? The biggest, deepest challenges we face are often completely invisible to the people around us. And here's what's really going on inside. This isn't just, the baby blues. These are real symptoms. She's not sleeping. She feels this disconnect from her own baby. She's crying and doesn't even know why. And the advice she gets, be strong for your children. I mean, that phrase, it just totally dismisses her pain instead of even trying to help. And that brings us to maybe the biggest wall of all, stigma. It's a huge problem. In her community, and let's be honest, in so many communities around the world, admitting you need help with your mental health, well, it's not seen as brave. It's seen as a weakness, something to be ashamed of. And so what happens? She stays silent, just like millions and millions of others. But here's the thing. Amina's story, as personal as it is not unique. Not at all. Her silence is part of a much, much bigger global silence, and it has absolutely devastating consequences. Okay, just take a second and let this number sink in. 1 in 3. Not 1 in 50, not 1 in 100, 1/3 of all new mothers in low and middle income countries. This isn't some rare thing that affects a few people. This is a massive public health crisis, and it's hiding in plain sight. And if you thought that last number was staggering, this one is just heartbreaking. 75%. 3/4 of these women get zero treatment at all. It's an unbelievable gap in care. It just proves that the systems we have now, they're just not reaching the people who need them the most. And it's not just about the mother, This silence, it creates a ripple effect. When a mother's mental health isn't supported, it can actually impact her child's development for the long haul. It can damage that incredibly important bond between them. So the stakes are really, really high. Okay, so that's the problem. It's huge. It's overwhelming. But in the middle of all this, a new kind of solution is starting to emerge. And it's not another big hospital building. No, it's something way closer, way more accessible. It's a lifeline that, quite literally, fits in the palm of your hand. So let's go back to Amina. One night, she's feeling totally overwhelmed. She's at her breaking point. And she takes this one small but incredibly significant step. She doesn't have to get in a car, find a clinic, make an awkward phone call. She just opens an app her sister had helped her install. And just look at how simple this is. This is not some long, complicated medical form. It's a quick private check-in. The whole thing takes less than a minute. You tap a button, rate your mood, pick a few emotions that fit, maybe type a short note. That's it. It's designed to be super fast, totally private, and as easy as possible. Okay, so Amina just sent out this quiet little signal, a digital flare, if you will. But what happens next? This is the really cool part. This is where we see how technology can take that one tiny signal and turn it into real, actual support. Literally, the second she hits send, an AI in the background gets to work. And it's not just reading her note. It's looking at everything, her mood rating, the emotion she picked, and it's searching for patterns that might show she's in distress. Now, this next part is absolutely crucial, especially for privacy. The system doesn't share her note. Instead, it classifies her state, in this case, moderate risk, and it creates a private alert. So her personal thoughts, they stay personal. The whole point is to flag that someone needs help without broadcasting all the details. So that alert, it gets sent directly to her sister, who she chose as her trusted guardian in the app. And the notification is smart. It doesn't overshare. It just gives a clear heads up and a simple recommendation. Hey, counseling might be a good idea. It's basically activating her own personal support system. And right here, this is where all the hassle of the old system just disappears. With a single tap, her sister can see the alert and book a care visit for Amina. That giant gap between realizing you need help and actually getting it, boom, it's closed, instantly. This smooth connection, this is the real game changer. It's the core idea of this whole model. It completely flips the old way of doing things on its head, because this is what happens when care finally starts coming to the patient. So what's the result? A verified professional counselor is scheduled for a home visit. Just think about all the barriers that one action just knocked down. No figuring out transportation, no sitting in a crowded, awkward waiting room, no fear of being seen by someone you know. The care is delivered on her terms in her own home.
Yeah, this really lays it all out, doesn't it? The old way is all about stigma, shame, travel headaches, and just a confusing, broken system. But this new way? It's built on privacy, on convenience, on a connected network that actually works for you. It's not just a small tweak, it's a total redesign of the whole experience.
And the help doesn't just stop after one visit. That's just the beginning. It's a whole journey to healing. Follow-up sessions can happen over video calls. If medication is needed, that's coordinated with local pharmacies. All her records are kept safe and secure. It's a complete circle of care, a whole ecosystem.
Okay, so let's just zoom out one last time. Let's think about what this really means, big picture. When you design a system like this, the impact goes way beyond one person. It creates this powerful ripple effect. And it all comes down to this one big question. What happens when we stop asking people to find their way through our complicated, confusing institutions, and instead we design systems that find their way to them? Well, the answer seems to be that real lasting healing can finally start, right where it matters most, at home.
And that new reality? It's exactly what organizations like AfriPharm Health are building. All their work is focused on this one simple but totally revolutionary idea: bringing healthcare home.